Good afternoon. It is Tuesday, March the 2nd, 2021. Sego, David Lahashu Juts, and welcome to today's COVID-19 Task Force update on this, our 183rd edition of Kahnawà 911. Today our guests will be Don Montour-Lazare from the KMHC and Lloyd Phillips, Commissioner of Public Safety. And we'll start off with our first guest, Don. Don?
So I'm here to talk about our vaccination clinics that'll be starting this week on Thursday. I'm so excited. We've been waiting for this so long. So we've been waiting for. We've been prepared for quite a while, and now we're going to get started. So, like I said, we'll be starting on Thursday. We're doing the 80+ group. We initially started 85, but we're not getting many bookings. So. Kahnawà, if you have anybody who's over the age 80 and they need to get booked for their vaccines, please don't be afraid to call the hospital, 450-638-3930. We're using extension 2295 and 2206 to book appointments. We're keeping the lines open till 6 o'clock this evening, so if anybody wants to book an appointment, you're more than welcome to call. While we're vaccinating over the next month, we will be decreasing some services in Kahnawà at the hospital because we're using the same nurses to do different jobs. So foot care will be greatly affected. We're going to be shutting down the services for the month of March. But if you have anything urgent, you can call the clinic nurse. Clifford Delabous will still be working in the clinic, and if need be, he'll take care of any urgencies at that point. Diabetes education as well too. The wellness nurse may be decreasing some of her services, as well as cancer support, but like I said, they will be handling the more urgent cases as they go along. One of the things that people are asking us about, a lot of questions about, is about the safety of the hall. So we're going to have all the safety precautions for COVID-19 all in place for everybody to get there. As you walk in the building, you'll be given a new mask, an N95 mask, not an N95 mask, a procedure mask to make sure that everybody's protected coming into the building. So if you come in, wear your own mask, but you'll be asked to switch out. Then you'll go in to register, so it's important that you bring with you your Medicare card, hospital card if you have it, either or both would be great. And we will be posting online the consent forms and the registration forms on the booking site. For the 85+ group, we'll probably just be filling it out at the site for the next 2 days. Once you get into the hall, there's 6 lines that are available for vaccination, but up to 6 lines depending on the availability of nurses, and the spacing between the lines is more than 10 feet, so we're not worried about distancing in there. There's lots of space, no concerns there. And once you're through, you'll be sent to an area to wait where all the chairs are social distance, at least 6 feet apart, with a clock there to monitor your time when you're coming in. I understand as well too that there's people that are somewhat hesitant about getting vaccines, but I'm trying to assure you that the vaccine is very safe. Majority of our staff at the hospital, a vast majority of our hospital staff have been vaccinated. We wouldn't be getting vaccinated, and we certainly wouldn't be encouraging people to vaccinate if we thought there was any concerns with regards to the safety of the vaccine. It's important that we have to look at the bigger picture, which is the concern about getting COVID, which is much more serious than any reaction that you could have from COVID or from the COVID vaccine. So the most common side effects from the COVID vaccine is a sore arm. Sometimes people may get a little bit of fever and chills or achiness. Those are similar to any vaccine that we would be giving, and it's really more related to an immune response, so it's something that we'd be expecting. I also had questions about people who have severe allergic reactions to lots of different things with foods and that. Very few allergic reactions have been happening, and it's more if somebody has an allergic reaction, it's more because we're related to one of the components of the vaccine. And I can't remember the name exactly quite well, but polyethylene glycol is one of the components the ones that they're worried about having the allergic reaction to. Anybody else who's had any kind of reactions like to food allergies and that, no concerns whatsoever, that we've been reassured. But if you're worried about anything, we will be having the Kahnawake Fire Brigade on site to handle any emergencies, and hopefully we won't have to use them, but we'll be using them to help support us with, with people that might need a little bit of help getting around, and also helping with cleaning the seating area where we're waiting. The question also was, what happens if I get COVID while we're doing the vaccination? Well, since I'm doing the contact tracing to start off with anyway, if there's anybody that gets put into isolation because of contact with COVID, you certainly can call the hospital and call extension 2213, which is my extension, and let me know, and we will make sure that we keep some vaccine aside to make sure we can vaccinate the people that at the end of our vaccination period. I also saw on Facebook where people were concerned about fertility and how it might affect women's fertility, and there's no evidence anywhere with regards to any fertility issues with regards to any vaccines, not that I know of, and this is no different with COVID. Now, what's important now, what we're trying to do is to make sure that we get herd immunity. Now, herd immunity means that we have enough people in the community vaccinated to help protect the majority of the population. The only thing is that we don't know what the threshold is for herd immunity with COVID vaccine, because it's just a new vaccine and we're still learning as we go along. But we know from history that we need at least a 75 to 80% vaccination rate, and we're hoping to shoot for 95. That would be the best case scenario, because that's what we know for measles vaccine is 95%. And so if we can get that kind of protection, we can make sure that the community stays safe. We have to remember as well too that there's still going to be a lot of people that will not be able to get vaccinated right now because we don't know about the safety with pregnant women or with the children under the age of 18, because we're going to be giving Moderna. They are doing some studies right now with younger people, and as we know more information and if we get permission, we will start vaccinating that younger group, but right now we are only doing 18 and over. So the things we need to know about after we get vaccinated. So we know that it can take up to 3 weeks for people to get some protection from the vaccine, and of course we don't get ultimate protection until we get our second dose. The second doses are now being given 84 days after the first dose. That's what Quebec is asking us to do. We also know that there's a 95% chance that it protects you from getting sick. So that's a good thing for both for Moderna and for Pfizer. But that's in reasonably healthy individuals. We also know that the elderly and people who are immunosuppressed or immunocompromised would not get as good immune response as somebody who is has better health. So the question is, do you feel lucky? Are you in part of that 95%, or are you part of the 5% that doesn't get the great protection? We don't know that. So what we're saying is that until we know better, we have to continue wearing masks after we get vaccinated, continue distancing and washing our hands. That's what we know protects us. We also don't know if if it's still spreading the virus. If we're still spreading the virus after, then we know that wearing a mask protects others if we're happen to have the virus as well too. The other thing is that the studies that have been done with the efficacy, we know that the studies do not particularly say if if the participants were wearing masks after they got their vaccination. We can probably assume that people are getting vaccinated, are wearing masks after the vaccinations, because that's what public health guidelines are right now. So that might explain for the high efficacy. So that's why we are encouraging people to continue wearing masks. The other thing we don't know the duration of the immunity. We know that people who get COVID have immunity up to 90 days right now. And we don't know what's going to happen with the vaccines because there's not data for that. We know that it's efficacious from preventing people from getting sick, but we don't know how long that protection lasts. So that's important as well too. So we may know somewhere down the line that we may need boosters. We might find out we might have to do it on an annual basis like we do the flu shots. These are all unknowns, but they're coming. I mean, with all the studies, and as more people get vaccinated, we have more data. And remember, if you're looking at information about vaccines, it's important that you get your information from reliable sources. Facebook has connections to some reliable sources, but not everything is reliable. So I recommend that you pick something that has, like Health Canada, Public Health Agency of Canada, Quebec. .ca has a lot of Quebec.qc.ca has a lot of resources there for COVID, and of course the KMHC /COVID has a lot of information about COVID and about vaccines. So again, if you want to get vaccinated, we're encouraging anybody who's over the age of 80 now to get vaccinated. You can call the hospital right now at 450-638-3930 at extension 2295 and 2206. We have operators waiting for your call. I feel like a telemarketer. But so it's important. We want to make sure these people get vaccinated. We're not sure that this is a population that certainly wouldn't be on online to be seeing all this information, so we're relying on family members to try and get hold of their older family, their elders, to make sure that they get vaccinated. We unfortunately at this point can't offer doing it at home, so anybody who's being serviced by home care, we're also asking them to come in as well too. And we have also made arrangements with medical transport to bring people in. So if you need a ride to get in, medical transport will bring you in. Everything's safe with medical transport. They have everything going to make sure everybody gets a safe ride. And but of course we encourage family members who are already in contact with our elders to bring them in, because that's the safest option, of course. And again, if you have any questions about the vaccines, you can check again on kmhc.ca. Yeah, I'll go.
Thank you very much, Don. And just a reminder to our community members who may be trying to reach the KMHC right now to make their appointments for their vaccines, the lines, if they're busy, the answering machine will come on, so please try again, okay, just to ensure that you do get through. And speaking of the vaccination campaign, of course, a lot of work has gone through or gone on for the vaccination campaign site. And right now we're going to do a walkthrough with Ajeza Foote, who oversaw the logistics and the setup of the bingo hall.
Good day, everybody. My name is Ajeza Foote. I'm the Emergency Management Technician for Public Safety. I want to discuss the upcoming vaccination site so that the individuals would know what they expect when they show up. When you're coming in for your appointment, you would enter the parking area, and it's advised to park on the left side, east side of the Mohawk Bingo parking lot. This is to ensure that when you exit the building, your vehicles are closer to where you come out from. So, and it's to mitigate the chances of crossing each other when you're coming into the vaccination site. You would enter through the door that I just entered from. It's indicated with the green enter sign. You'll meet up with a security that's going to ask you if your appointment time, and it's advised to be if your appointment's at 10 o'clock, come to the door or come inside at 9:55. That gives enough time to register, and so there's not a big lineup inside. There is provisions made for outside, so medical transport can come right up to the door for the elderly, and they could get dropped off there and then enter in. So when you enter the building, you're going to end up putting meet up with the security. They're going to ask you to switch over your masks to a procedure mask. This is just as a safeguard for the vaccine technicians, the nurses, and anybody else that's in here, because we're going to be in a secure location, but we just need to make sure that everybody's following the same measures. So at this point, you're going to walk through every spot that you first enter. There is the posts here are 6 feet apart. So that's every time that if there is a lineup that might happen, everybody needs to stand in their designated area and then proceed through. There is going to be registration booths set up. So at this point, you would wait here. When a registration booth is available, then you proceed to any booth that's indicated as somebody that's there. So then you do all your registration, make sure that you have your Medicare card, any other documents that are required to speed up the process and make sure it goes as smooth as possible. So at this point, once you finish here, you'll come in, you'll follow the same thing. So at this point, you're actually entering the vaccination site, the layout. After you get through your registration area, you come up here, you're gonna be waiting here. You'll meet up with a security personnel, and they will tell you what number to go into that's available. At that point, we do have 2 handicap spots available, and every bay is situated as a one way in and one way out. This is to keep in mind of the physical distancing, and so we don't cross paths with each other. The security would tell you to come in, say number 3. You'll come in, you'll follow the same distance requirements from the lobby. You'll come in here, you hand sanitize. Before you enter the booth area, you hand sanitize. And then you come back, and then you come sit here into the chair. And then you wait for the nurse. At that point, you'll be able to read all the information pertaining to the vaccine that's right across from you. Each booth has the same information. So after you get your vaccine, then you'll follow the exits, the arrows, sorry. Every bay has them, so it's flow directional. So you come over here, all the way down, then you'll immediately turn to your left. Then you'll go into the waiting area. So once you get here, you sit down at one of these seats that are open. At this point, you would get you watch the clock. Like I said, it's 9:45 that you got your vaccine. So at 10 o'clock, you'll be able to leave, proceeding to the exit. While this vaccine site is operational, we do have medical staff present. So in the event of any complications or you're not feeling well, you just raise your hand. Don't get out of your seat. Just raise your hand, and then one of the paramedics would show up. When you sit here, you got the clock on the wall in front of you, and you just watch your time. There will be a TV there. It would rotate different information on there and all that stuff. So after your 15 minutes, you'll get up, and then you walk directly in front of you. You follow the arrows that's indicated on the floor, and then at this point, you'll meet up with either a security or one of the paramedics. At this point, you will check you have to give them your paper, and it will show the time. They'll verify the time, and if they might ask you a couple of questions, how you feeling and all this stuff, and if you're great and everything, then you proceed outside. The location was designated to be in an area where safety and efficient as possible due to the COVID pandemic. So everything was placed in a way to be safe as possible and efficient as necessary. Also, I want to mention a big shout out to the Kahnawà Mohawk Bingo to allow us this opportunity to do the mass vaccination for the community. So a big shout out to them. We couldn't do this without the bingo hall. So until next time, thank you very much, and have a good day.
Hopefully the walkthrough that Ajeza did will help you become accustomed to the vaccination center and feel a little bit more comfortable. It is the bingo hall after all, so really nothing to be afraid of, and it's also extremely safe in there. They did a really great job. Coming up next is Lloyd Phillips, Commissioner of Public Safety, to provide us with some more information. Lloyd?
Thank you very much, Dave. Thank you, Don, for that information as well, and as well as Jeza for that walkthrough of the site, which I know a lot of work went into there, and it's very, very well done, very professional, and very safe. And certainly, this is an exciting time for our community. On Thursday at 10 a.m., the site will open, and people age of 80 plus will have the opportunity to be vaccinated, and the site will be opened on Thursday and Friday. And then afterwards, we will be reopening at 9 a.m. on Tuesday for those people who are 70 plus years of age. They will be eligible to start getting vaccinated on Tuesday morning. And the bookings for that will start on Thursday. It'll be online, as well as there will be the phone line also available for those people to book their appointments. More information will be coming on this tomorrow, but certainly, again, exciting time as the vaccine is really going to start rolling out a lot in our community over the next several weeks. No, this is our opportunity as Kahnawake to get the vaccine. We had this window for this month where we're going to have enough vaccine for any Kahnawake who wants a vaccine, can get a vaccine, and it's going to be what I said several times, it's going to be the beginning of the end, and there's that light at the end of the tunnel is getting much brighter. We all want to turn back to a life that is more normal, and this is definitely the path that we got to follow to get there. So again, we highly encourage all Kahnawake to get a vaccine, and this is your opportunity while we have our site in operation within Kahnawake. And I know there's a lot of people out there who watch Facebook Live who are not part of residents of Kahnawake or part of our community. Unfortunately, the site set up here and what we're talking about, this information, is for Kahnawake residents only, or Kahnawake. So unfortunately, if you're not part of the community, you got to follow the processes that are set forth by the Quebec, and each region is slightly different. As you may see, Montreal has a slightly different process than they do in the Montour-Lazare, as well as other regions in Quebec. But this information, and this is for Kahnawake only. So the other information I want to relay into the community, I know because we get a lot of questions about prioritization of individuals. Obviously, elders are the focus, and we're going to be doing 70 and up very soon. We're having more discussion on that over the next little while. More information will be coming out. But I think what people have to really understand is we're talking about a very short window here. We're looking by the end of this month to have the community done the vaccination process for the first dose. Whereas outside Kahnawake, you're going to be looking, between 4 to 6 months before that vaccine process is going to be rolled out for the first dose. So we have a short window here. So even if the priority levels is not the same as you may be seeing on the news and such, but from the beginning to the end of vaccinations in Kahnawake will be just a matter of a few weeks. We're not talking months like they are in many other places. We're talking only a matter of a few weeks. So we came this far. We know it's been a really rough year. We still have some road ahead of us. We still have to get the vaccine, first dose, second dose. We still got to maintain distance, mask, and hygiene, and obviously check in on well-being. But we're getting closer and closer, Kahnawake. Let's hang in there a little while longer. Let's be vigilant, and then we'll see things start returning back to normal as soon as we possibly can. So with that, again, stay tuned. More information to be coming tomorrow regarding the rest of the vaccine process, and we'll be in touch. And on the goodbye.
All right, Nyawa Lloyd, of course, like Lloyd said, please pay attention and stay tuned to K911 and also monitor the social media sites, so we do upload information ASAP, so it's the best way to keep informed. And just to let you know that after each of these shows, we will be showcasing some testimonials from those people who did get their COVID-19 vaccination. And if you'd like to submit your own testimonial, you can email it to questions@mck.ca, or you can visit the Kahnawà 911 Facebook page and you can just submit it through the messenger there. And that's it for our program today. We'd like to thank you for joining us, and please stay tuned for further episodes. We'll have more information for you. From all of us here, Nyawagoa, Danu, Onagiwahi.